Where is your question? Right. So if you have read and understood, considering it's surgical pathology station, kindly tell me, how would you address the patient's query?
I will inform him based on his last surgery and histology report.
Yes.
He has got lung cancer which has locally invaded into his pleura and lymph nodes.
All right. Considering the report, what do you think? What is the situation at hand for the patient?
Um, Based on the histology, he is having small cell lung cancer which was locally invaded, and he may need some chemoradiotherapy.
What are the types of lung cancer which are present or can be present in a 59 years old male?
Lung cancer can be two types, and small cell lung cancer or non-small cell lung cancer. Non-small cell lung cancer include adenocarcinoma, squamous cell carcinoma, large cell carcinoma, and adenosquamous carcinoma.
Okay, my question was, which one is more common? Which carcinoma is more common in a patient, 59
Being a,
years old patient who is smoker?
yeah, being a smoker is more prone to develop a squamous cell lung cancer.
Squamous cell carcinoma. What is the mode of spread of squamous cell carcinoma?
Uh, Lymphatic.
Through lymphatics. Okay. So what advice would you give to the patient?
I will advise him to stop smoking,
Yes,
avoid
as healthy.
exposure
Yes.
to uh, chemicals like arsenic, beryllium, and asbestos, dyes, etc. And also, I would
Yes. This is histology which has been done, right? So what would be the next plan of management that you'll carry out or you'll plan with the patient? In other words, what is the treatment of carcinoma?
and
Lung
depending upon,
carcinoma. Yes.
I will like to stage the carcinoma. For that, I will like to take a HRCT
Okay. And
and uh,
what type of tumor of lung carcinoma can have, which has carcinoid tumor, and it's invading pleura and lymph nodes as well?
small cell lung cancer.
Yeah, you said that, but could that be present anywhere else? Okay. What
I
are
will
the,
come back.
okay, can you tell me, lung carcinoma, could it be genetic?
As genetic predisposition can be there, ma'am.
What are the genes which are associated with lung carcinoma?
TP53,
Yes, and
KRAS, EGFR.
yes, very good. What are the, okay, you told me that you'll do the staging, but could there be possibility that you can ask for any blood test to see the tumor markers present for this patient? Could there be a need?
I will come back to.
Okay.
Yes.
What are the types of pathologies which you can encounter for pleura?
Pleural plaques can be there.
Yes, this patient is having. Yes, and
Mesothelioma.
yes, so that's malignancy. There could even be just isolated thickness without idiopathic. So, yeah. So, how
Okay.
should a patient with pleural pathology be treated or managed?
These pleural pathologies like pleural plaques can be pre-malignant, and hence they should be evaluated for.
What is the significance of having pleural plaques?
And these are usually fibrosis due to chronic inflammation,
Yes,
and these are pre-malignant lesions, which can
yes,
develop into mesothelioma.
yes. And normally they can be present on both sides. And how a patient presents if a patient has pleural plaques?
Usually they present with catching pain,
Okay,
shortness of breath, pleural effusion.
okay. How would you differentiate small lung carcinoma? You said if a patient is suffering from lung carcinoma compared to mesothelioma.
Mesotheliomas are usually peripherally located, while small cell lung cancer are centrally located. Small cell lung carcinomas, they usually metastasis early compared to mesothelioma.
Yes,
Mesotheliomas are locally widespread, and hence the treatment is usually palliative, while
yes.
in case of small cell lung cancer, uh, curative treatment is possible.
All right.
And
Yes. What are the risk factors which are associated with mesothelioma?
it's mainly due to exposure to asbestos.
Yes, and smoking,
Uh,
radiation, could even be
uh,
genetic. Which gene?
okay,
No. Insolatile minerals, BAP1 gene.
okay, ma'am.
All right. Okay. Right. What are all right? If this patient come back after 1 month, and this time this patient presents with metastasis, you suspect, which are poorly differentiated, then what would you think the origin of cell would be?
I will do immunohistochemistry to identify the origin.
Yes, to confirm it. All right. Okay. Right. Okay. Yes. How long do you think patient should be managed, or what should be the management, or what should be
Depending
the
upon the
plan? Yes.
staging, ma'am, if it is only
I
a
told you.
local
Yes.
lesion,
Patient came with mets. Yes.
okay, then we have to go for chemo radiotherapy.
Okay. What are the tumors which are sensitive to chemoradiotherapy? What is something is present in them, or
They
what type
are
of tumors can be?
epithelial growth factor
Yes.
receptor positive,
Yes. So
tyrosine kinase inhibitor.
kinase. Yes. 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 That one. Good. Very good. Thank you. If we can, yeah, that's yes. Thank you.